Welcome, everybody. My name is Melissa Cruz. I'm with HLAA, and welcome to HLAA's OTC 101 webinar series. We're going to wait a couple of minutes to let folks get on in. I see lots of folks joining us, and we're glad you're here. So we're just going to wait just a couple seconds to let folks come on in. We're happy to have you join us to learn about over-the-counter hearing aids from experts at AARP and NIDCD. Today's webinar is the second in our series, and we've got two more coming on up. I'm going to go ahead and start with a few housekeeping notes here. To see captions on the webinar, you will need to click on the CC icon and click Show Subtitles. You can change the font size and the subtitle setting. And please use the chat for technical issues only. Use the Q&A window to ask questions. We'll get to as many as we can in our discussion, which will be moderated by HLAA's Executive Director, Barbara Kelley. Our HLAA staff, myself and several others, will also be monitoring the Q&A channel, and we'll be answering the questions there as well as we go along. All of our webinars are recorded and will be made available in our on our website. If you've joined by computer, the presentation should be in side-by-side mode. Your slides are on the left and the panelists are on the right in the gallery view. You can change the size of your screen in the side-by-side view by hovering between the two screens and moving the gray bar to your desired size. If you've joined by mobile device or phone, your view may be different and you may have to scroll between views to get to the desired one. Just a reminder that HLA doesn't endorse specific products or services, so we won't be taking those questions. Now I'm going to introduce Barbara Kelley, who will begin the OTC webinar.
Thank you, Melissa. The Hearing Loss Association of America makes hearing health a priority, and I'm so glad that all of you are here today. And we empower people with hearing loss and those at risk for hearing loss by providing reliable information and support so you can take action and live well with hearing loss. HLA advocates on behalf of all 50 million people in the United States with any degree of hearing loss. We offer a community of support that anybody is welcome to join. If you haven't joined HLAA or attended one of our events, we encourage you to be part of our important mission and to learn how to live well with hearing loss. Our hearing is so important because it's how we relate to the world around us. Hearing should be protected in noisy environments, checked and treated if there's an issue. Waiting to treat a hearing loss until it gets worse should never be an option. So you're tuned in today that we know that you're thinking about your hearing health, or you know someone who's thinking about his or her hearing health. But many people don't realize that hearing is an important part of overall health and wellness. And remember, there's no such thing as a small hearing loss. If it gives you trouble or your family tells you it's an issue, take some action. In 2022, the FDA opened a new category of over-the-counter hearing aids. Now, this is in addition to prescription hearing aids that you get through an audiologist or a hearing aid specialist. Over-the-counter hearing aids is just another pathway to care that gives some people choices. There's no one-size-fits-all to hearing care, and you could still see a hearing healthcare professional and get an OTC product. But an important fact about OTC hearing aids is that they are for adults only with mild to moderate hearing loss. So whatever route you choose, we hope it leads you to taking that first step sooner rather than later and placing your hearing health up there with your other health concerns. There's been a lot of news coverage lately and talk about these products, but many of us are understandably confused. Our HLAA survey shows that 68% of people who didn't purchase an OTC or didn't think about it said they didn't have enough information. So that's why we're here today for the second series of 4 webinars on OTC hearing aids supported by a grant from the CTA Foundation. So you can get information that you need, and we can get information to the general public to hopefully answer some of your questions. Now, not all topics involving OTC hearing aids or all your questions can be answered in this 1 hour, but we will try our best, and we won't have assessments of products, but we want to present some perspectives to you to give you some solid information. In addition to this webinar series, we have HLA's resources online on over-the-counter hearing aids, including a tip sheet, a shopping guide, article links, and a survey. And please complete the survey at some point and share it with others, because it helps us learn more about what you need to know, the attitudes, are you using these devices, and it'll help us shape the information that you want. Finally, we're very happy to have two panelists today, one from AARP and the other from NIDCD, which is the National Institute on Deafness and Other Communication Disorders at the National Institutes of Health. These panelists are going to help you answer some questions about OTC, and I want to thank you both for being here. First, we have Dr. Kelley King. She's an audiologist and program officer at NIDCD. Welcome, Dr. King. Tell us a little bit about yourself and your experience with over-the-counter hearing aids.
Sure. Thank you, Barbara, and really everybody at HLAA for putting this seminar series together and for inviting me to be a part of it. I'm really pleased to be a part of the conversation and also learn from all of you what questions you have, not just today, but through, for example, responding to the survey that Barbara mentioned. That's how we learn sort of where the needs are in this space. My background professionally is as an audiologist. I spent the first chunk of my career working in clinical research at NIH. I should say that NIDCD that you heard Barbara mention is one of the 27 institutes and centers that make up the National Institutes of Health. And at NIDCD, we are the largest funder of research and research training into hearing and hearing loss, as well as some other mission areas that we cover, such as balanced, speech, language, taste, and smell. So I worked in clinical research for a long time, and one of my favorite parts of that job was that I got to meet people from all over the country. And one of the experiences that I had is I had countless conversations with individuals who wanted to do something about their hearing health, but either weren't sure what they should do, or who I think more commonly felt like there were barriers to them getting there. And so this experience really gave me a front row seat to many of the issues that I think folks are hitting when it comes to accessing and benefiting from hearing healthcare. I then moved on from the clinic and into an administration role, which might sound terribly boring, but I promise that it's not, because now my job as a program officer for the Institute is to help oversee the research that takes place around hearing loss and audiology, and in particular, an initiative that our Institute has to make adult hearing healthcare more accessible and more affordable. I love this position in part because it drives public health. Research drives public health. And at the end of the day, I'm still a clinician trying to improve the lives of individuals with hearing loss. I'm just now doing it from more of the 30,000-foot level than being directly in the clinic. I'll point out that it was NIDCD supported research that informed the legislation that ultimately resulted in OTC hearing aids. And we work closely with our sister institute, the National Institute on Aging, that also funds work on hearing loss, including a recent clinical trial called the ACHIEVE trial that has gotten a lot of traction in the popular press and news lately because it explored the effects of hearing intervention and cognitive change. And we can absolutely talk more about that if it's an interest to folks. But I'll stop there and just again say how pleased I am to be here, and thank you for the invitation.
Well, thank you, Kelley. We are certainly happy to have you. We also have Dr. Charlotte Yeh. She is the Chief Medical Officer for AARP Services. Welcome, Dr. Yeh. Now you tell us a little bit about yourself and your experience with over-the-counter hearing aids.
Thank you so much. And like Kelley, I am just so honored and delighted to be here. And thank you to the HLAA for hosting this webinar. So as he said, I'm Dr. Charlotte Yeh. I'm the Chief Medical Officer for AARP Services. And what I do day in and day out, I live and breathe. How do we help people with products and services to live their everyday lives better as they age? Excuse me. So they can live independently in the home, be out and about in the community. It's a passion of mine. By way of background, I'm an emergency physician, practiced 20, 30 some years. So I really understand what happens at that nexus of healthcare in the community and where the pitfalls are. And certainly I've seen many a person who's had struggled with communication in the emergency department in crisis because they can't hear. So I cannot tell you, with, as you said, over 50 million people, 2/3 of Americans, 2/3 of people 70 and older who are suffering from clinically significant hearing loss, and how important that is. And in fact, in AARP surveys, it breaks my heart that only 26% of adults 40 and over have ever had their hearing tested. 83% have had annual physicals, but never had their hearing tested. And yet we know how prevalent this condition is. And even worse, people who say they've got hearing loss, 69% don't think they're supposed to do anything about it. So I think having over-the-counter hearing aids as another tool, as another option for addressing your hearing loss is great news indeed. By way of background and experience, I was part of the PCAST working group committee that actually looked at sensory loss and what are things that we can improve. And hearing loss was right at the top of it. And how do we make it more accessible? That came forward with the recommendation for over-the-counter hearing aids that became the basis for the legislation that Kelley managed. And then finally, I know it from personal experience. My father is 95 with profound hearing loss, but he started like every other person, gradual onset, in his 70s, absolutely refused to have a hearing aid because, he didn't want to be noticed until my mother was locked out of the house for half an hour because he didn't hear the doorbell. And as a physician, I thought he was getting dementia. He wasn't interacting with the family. He was shuffling with his walk. And the day he finally agreed to get hearing aids, he started telling family stories. He got up from the table. He had a normal gait. And he finally said, I was really lonely and I was really separated and I was too embarrassed to talk about it. And now at 95, he can use an iPhone. He does captioning on his iPhone. He does FaceTime. He does Zoom. He carries an iPad for captioning communication and is absolutely tech savvy and so appreciative that he can hear the family stories.
Charlotte, that's such a testament to why we need to take that first step. And I have to say, Charlotte, you showed me a video of your father dancing at a family wedding. So you forgot about dancing, but really amazing story. And since you were an emergency room physician, you probably saw a lot of older people who got there because they fell. And talk about falls and hearing loss.
Yeah. So we actually, while I was at AARP Services in conjunction with Optum, we actually did a very large scale observational study. Sorry, Kelley, it wasn't an NIH study, but we looked at the association of uncorrected hearing loss over 2, 5, and 10 years. And it turned out that over 10 years of uncorrected hearing loss, which is very common, there was a 52% higher risk of dementia, 41% higher risk of depression, and a 29% higher risk of falls. And you're probably going, why does that happen? Well, as your hearing declines, you can't necessarily get your balance. You can't necessarily hear the sounds. You start having a shuffling walk because you feel unsteady. And, the amazing thing to me is we have solutions now through the use of hearing aids, whether they're prescription, over the counter, all the way to cochlear implants. There are so many tools that are available to help people with hearing loss that it, to me, is a shame that we are not taking advantage of this.
And I think we've made between Kelley and Charlotte and all of us the point of why you should take that step to hearing healthcare sooner rather than later. So over-the-counter hearing aids has opened up another pathway to care. Kelley, what information should people know before they consider maybe buying an over-the-counter hearing aid?
Yeah, I think there's a few ways to think about this, Barbara. I mean, first and foremost, if you're considering an over-the-counter hearing aid, I think you should be thinking about whether or not you are a good candidate for it. And there's sort of the outside of the box candidacy criteria to begin with. One is, are you over the age of 18? OTC hearing aids are not for anyone under the age of 18 who should be seen instead by a hearing health professional. So over the age of 18, an adult with perceived mild to moderate hearing loss. And that word perceived is an important one because, you know, when the legislation around OTC was enacted, it was done so to say that these devices should be available direct to consumer without having to go through a provider and without requiring a hearing test. Now, you very well may have a hearing test to know that you have mild to moderate hearing loss, but I think you could begin with thinking about your hearing and your hearing loss and how that shows itself in your life. So do you have trouble hearing and understanding speech when there's background noise present? That's one of the number one complaint of people with hearing loss is listening and understanding speech when there's competing noise. Is it hard to follow conversation when you're in groups of people? Do you have trouble hearing on the telephone, or do you feel particularly tired after listening? Do you find that you notice or that your family notices you're turning up the volume on the TV or the radio? So there are signs that may indicate that you have mild to moderate hearing loss. And there's a way to distinguish that from more severe hearing loss where you may have trouble even listening in quiet. That may be an indication that OTC devices aren't a great fit. So that's sort of the first step. And then I also think it's important that you sort of do a scan of what your options are. Is accessing an audiologist even feasible for you? For a lot of Americans with hearing loss, the answer to that question is unfortunately no. And so understanding the choices in front of you is important. Do you have access to an audiologist? Is OTC your only option? Or is there something in between? And then I think it's worth weighing whether exploring hearing aids and trying them for the first time is something you want to take on sort of independently, or whether you think you might benefit from working with a hearing healthcare professional, assuming you have access to one. One thing to keep in mind about the new choice around OTC hearing aids is that while in several ways they make access more easier than prescription hearing aids, they also bring more of the responsibility of management onto the individual. And so some folks are going to be naturally strong in that space, and I think others are also going to naturally need more support. And so thinking and reflecting on whether you as an individual consider, you know, taking on the management of OTC hearing aids as something you want to try independently is an important first consideration.
Charlotte, thank you, Kelley. Charlotte, can you respond to that and also include like seniors? How do you see seniors taking on an over-the-counter product?
And so I think the beauty of having the avenue of over-the-counter hearing loss is it's really designed for people with early, mild to moderate hearing loss. So you can start on that journey before you necessarily need to go all the way to prescription hearing aids. Now, whether you decide to do an over-the-counter or go with prescription hearing aids, part of it depends on yourself. I think Kelley mentioned how digitally comfortable. Are you one of those people that likes to do it yourself? You want to do the research, you want to explore where the different options are, test it out. If that's who you are, then it's not just whether you have access to a hearing specialist, but it also means that you want to test and try it yourself. And I think that is important. Secondly, are you the kind of person who likes everything kind of simple, preset? Or are you somebody who likes to fiddle and self-fit and self-adjust? Because those help you decide what is the right kind of choice for an over-the-counter hearing aid. you want to think of some of the technical aspects. Are you somebody who's out on the road all the time and don't have time to recharge batteries? So you want to get replaceable batteries that you can change because you're traveling on the road? Or do you want rechargeable batteries because you're just out for a few hours during the day? It's easy to be at home. So as you think through this journey, your choices are really, how do you live your life? And what are you using the hearing aids for? And then you can begin to look at the specs and say, you know, I can do it myself. I'm early in the course. I can do it without an audiologist, or I'd like an audiologist to help me choose between an over-the-counter and a prescription hearing aid, or I want to go straight to a prescription hearing aid, you know, in a more formal setting.
I correct me if I'm wrong, but I see a lot of the over-the-counter hearing aids are adjusted through an app on your smartphone. So I think it would be important, first of all, if they are a senior, do they use a smartphone? Are they comfortable with it? Is that correct in saying that a lot of them are adjusted through the smartphones?
Absolutely. Now, there are less expensive over-the-counter hearing aids. They may not work as effectively for your particular hearing loss that are preset and don't require working with a smartphone, but many of them require using an app and a smartphone. Now, the good news is we have AARP surveys that say, on average, you know, 80–90% of people 50 and older actually own a smartphone. And in fact, for the 70 and older, about 70% actually own a smartphone. So it's not out of reach. It's not out of possibility. And in fact, my favorite number is over 80% own up to 7 devices. So
that's terrific. I mean, 10 years ago, maybe this market for over-the-counter wouldn't have been ready because
correct.
of older people not having smart devices. What is, you know, there's still confusion. People ask us all the time, where can I get a hearing test? I know I'm having trouble in background noise, like Kelley said, or having problem on the phone, but I want a hearing test, but it's not easy to get to an audiologist. Where should I go? Where should I get one?
So if you want to do kind of a first-time screening or a simple screening or to monitor your hearing over time, AARP has a hearing resource center and we'll give you the link to that. But on that resource center is the National Hearing Test. And this was NIH funded, the first time that you could do screening for hearing over the telephone. If you're an AARP member, you can get this for free. If you're not an AARP member, it's $8, so it's not a huge expense. And there are now hearing tests that you can actually do off of a smartphone, whether it's Mimi, Sonicare, etc. So if you cannot get to an audiologist or you want to, in your own privacy, check your hearing, there are options already available. If it shows that you have evidence of mild to moderate hearing loss, then you might want to consider an over-the-counter hearing aid. And the important thing is some people think, oh, if I get a hearing aid, I need it all the time. And suddenly I'm going to be wearing it everywhere. But what's really nice is sometimes hearing aids are situational. You heard Kelley say, sometimes it's background noise. Sometimes it's at a restaurant where there's a lot of conversations going on. That might be that you wear hearing aids situationally, which over-the-counter hearing aids may be very well suited for. And then as your hearing loss progresses, you may then become more used to it and then be comfortable if you need to wear it more.
What if you have just hearing loss on one side and people think, oh, you have a perfectly good ear, but the other, you know, you hear fine, but we know that, you know, there's a reason you have 2 ears. You hear with both ears. What if you have hearing loss in one ear? Would that work for an over-the-counter hearing aid? Would that be a possibility?
Yeah, that's a great point, Barbara, that you made about us, you know, sort of having 2 ears for a reason. Our brains and our auditory system are really wired to take in input with both ears. And in fact, when you have normal hearing, our ability to listen in background noise, the reason we are so good at that is because we have 2 ears. And so when you lose one, it becomes very, very difficult to listen in noise. It also becomes next to impossible to tell where sound is coming from. And that's, of course, a safety issue. You cannot rely on your ears to tell you that the car is coming from the left. And what I've learned from working with people with hearing loss in one ear over the years is it's not that their brain tells them, I think the car is coming from the left, or it's not that their brain tells them, I don't know where the car is coming from. It's that their brain tells them the car is definitely coming from the left, and they're often wrong. So that's a real complicated hearing loss, even though we think, oh, but you have a normal ear. Out of the gate, that is not an individual who is suited for an over-the-counter hearing aid. There are a variety of what we call red flag conditions that are going to be on any OTC labeling that you're going to see, that basically say, if you have one of these conditions, don't get an OTC hearing aid, but instead go see a physician, and ideally an ear, nose, and throat physician who specializes in hearing loss, because there's any number of conditions that need to be medically treated that can cause one ear to be better than the other. So first and foremost, that person needs to be seen by a physician. And then again, as I mentioned, those are very complicated hearing losses to fit, and would be an example of someone who could really benefit from working with an audiologist to best do so.
Thank you. Looks like Meredith's on the screen. We must have a question. Oh, Charlotte, go ahead. What were you going to say?
I just wanted to agree with Kelley that there are medical conditions that can cause one-sided hearing loss that actually need to be treated and need to be diagnosed. So it's not something you want to handle on your own. The second is, it's not just that you want to hear which side things are coming from, but as we said earlier, hearing loss is associated with a high risk of falls. You need both ears to help you with balance, to hear the sounds on both sides so that you can walk in a more steady fashion. So I'm really glad that this question was asked, but importantly, that's the one time to see a physician and an audiologist.
I had this question from someone who has single-sided deafness, and he knows the reason for it. It's Meniere's, but he's a biker, and he can't hear anybody if he's biking to the left, and it's caused him to have to turn his head and lose his balance and reorient. So he was wondering, would an over-the-counter product be good? He knows the reason for his hearing loss. He's being medically treated, but it causes a problem. We have Meredith from our staff on the screen, which means we've had some questions popping up in the Q&A box. So please put them in there. We might not get to all of them, but we love them. Meredith, go ahead. You're on mute. Meredith, you're on mute.
Okay, we have a question. What are the areas of research on OTC hearing aids that should be prioritized?
Kelley, would you like to take that one?
I would love to take this question. It's such a good question. Thank you for asking it. You know, I think one of the important takeaways for all of us is the recognition, as Barbara said, you know, that this became reality in October of 2022, I believe. This is still brand new. It's new to consumers. It's new to insurance providers. It's new to audiologists and hearing scientists and manufacturers and researchers and clinicians. It's new to all of us. And so we still have a lot to learn. We have so much to learn about who OTC hearing aids are best suited for, and how new and variable service delivery models, how that might affect this. How do we make the technology better? How do we make it more affordable and more accessible? So we have a lot to learn in this space and around hearing healthcare in general. At NIDCD, one of the major funders of research on this issue, we have a variety of ways to engage with all kinds of stakeholders on this topic, including individuals with hearing loss who are such a critical voice to answering this question, and which collectively inform sort of how we are prioritizing our research. But if I can flip the question back to all of you, and maybe you can email me offline, I'd love to hear from this group what you all think the priorities are for our research, because we know we have a lot of questions to still answer.
Thank you,
And
Kelley.
if I could just add one more area that I do think research is needed is really the user experience. So just as you said, Barbara, many of the hearing aids, whether they're prescription or over the counter, are tied to the use of a smartphone. And we know that you want to have an ageless design or an age-friendly design on how the icons appear, the size of the icons, the contrast, that they're not adding cognitive load and make it more complicated. So I would love to see research being done on what makes for a good, easy, simple user experience that's intuitive, instead of forcing, whether you're young or old, but particularly old, how to understand how to use the technology. AARP has OATS, the Older Adult Technology Support. It's an organization with volunteers that will actually work with older adults to help them optimize their use of technology and how to use it. So,
And I think this is so important because this is a brand new market. So hopefully we see advances and evolutions in technology, but we also learn about the users. What are their attitudes toward adopting use? What are the features they need? And I mean, hopefully 10 years from now, we know a lot more and we understand a lot more about this. We have a good question in the chat, which everybody should always ask on anything. Are there any risks or dangers to using an over-the-counter device? Can they be used unsafely? What are the risks that people should look out for?
Yeah, I'll start. I mean, as we mentioned a few minutes ago, every over-the-counter hearing aid is going to contain on the outside of the label or the outside of the box labeling around the conditions that are contraindicated, or basically red flag conditions that say, don't purchase this hearing aid. Instead, go see a physician or a hearing healthcare professional. So certainly starting from the place of following those guidelines would be critically important. Then I would also say, if you're using an OTC device and it's painful or uncomfortable or feels uncomfortably loud, you should discontinue use. And that's also an important part of anything that you're putting in your body, including in your ear canal. And also where, the volume may be something that you can control. You should never be turning sound up so loud that it's uncomfortable, because you wouldn't want to cause damage to your hearing. That's unlikely to occur from OTC hearing aids, but there are many products that if I use them inappropriately, that I purchased at CVS or some other over-the-counter space, that I could injure myself. And so following the directions on an OTC hearing aid is going to be really important. Aside from that, I would consider the financial risks and the risks of your time, right? Hopefully you're doing some homework in advance and trying to decide which of these products is best suited for you. So that takes an investment of your time. And then the financial risk comes down to what the return policy is on the device if you are not satisfied with it. And that is certainly a key piece of advice that I would offer for anybody considering any hearing aid, whether it's a prescription or an OTC hearing aid, that you go into the purchase of it fully understanding what the return policy is around that particular device, so that you know if you have a chance to use it and decide if you don't like it or if it's not benefiting you, that you have an opportunity to return it, and at what percentage of what you initially paid for it. So those are the major risks that I would think of.
And if I could just add on to that, you want to be sure that you're actually purchasing a true certified over-the-counter hearing aid. There are other types of devices that just simply amplify sounds and that are not regulated and don't follow the guidance that the FDA has put out for safety purposes. So, it is a buyer beware. Make sure you are truly seeing an over-the-counter hearing aid certified category. And then on the financial risk, although Medicare formally does not cover hearing aids, because back in 1965, hearing loss was considered normal aging, and we now know that not to be true. But there are many Medicaid plans, Medicare plans, commercial plans, and especially the VA that do cover hearing aids. So make sure you learn whether you've got some coverage, some contribution that can help reduce the cost to you. And one advantage is over-the-counter hearing aids for, again, mild to moderate hearing loss do tend to come in at a lower price point.
We have a lot of questions about cost there, Charlotte, and some people want to know, because there's over-the-counter hearing aids on the market, does that necessarily mean that traditional hearing aids through prescriptions are going to come down in price as well? So maybe you can talk about that and how prices are bundled and what's included in a prescription hearing aid, what's not included in an over-the-counter.
Yeah, I think the final verdict is still out because actually over-the-counter hearing aids are still relatively new. They've only been in the market a little over a year. So I think it will take time to see where the pricing, the competitive market settles down. And it may not only affect the prescription hearing aids, but may affect the cost and pricing of over-the-counter hearing aids as well. I think secondly, it is opening up the market where you can have an audiologist help support you without necessarily being bundled or tied to a particular type of hearing aid, that you will now begin to see more choices and support for the different kinds of choices. I think for now, in current time, besides pricing, customer service is really, really important. Is there customer service that's easy, friendly, and helpful to help you fit the hearing aid in a way that works for you, or to assure that it's the right one for you? What is the return policy? Absolutely, you want to have a trial period so that you can return it if it A, does not work for you, or it's just not user-friendly for you.
Can I make a comment jumping off of that, Barbara, just because
Yes,
I feel like we've touched on this issue in a number of different ways, but I sort of want to name what I hear Charlotte saying and what I have been saying to some extent, which is the idea of managing expectations when you come into the purchase of any hearing aid, whether that's an OTC or prescription hearing aid. If this is something that's new to you, I think there's a set of expectations that go along with the technology itself. And some of that speaks to what Charlotte was talking about early on, about sort of thinking about and understanding what are your listening needs, where are the situations that you have trouble, how many bells and whistles do you want to go along with that, how technology advanced do you want the device to be. So thinking through all of that, also understanding that the technology itself is not a cure. Putting on hearing aids is not like putting on reading glasses, and you don't suddenly return to normal hearing. And I think having a real understanding of that expectation going in to the purchase of devices is important. And then there are the expectations around you as the user. For the majority of people with hearing loss, it's been adult hearing loss. It's been a gradual onset that sort of insidiously snuck up on us. And that means that we've gone maybe, a decade or more without hearing certain sounds or hearing them well. That means that it will take your brain time to adjust to listening to those new sounds. I used to be tickled as a practicing audiologist when after being fitted, people would call me up from their car or from their home and say, "What is that sound?" And I'd have to point out to them that that's the turn signal in your car. You haven't heard that one in a while. Or that's your refrigerator running. Those are background sounds that people with normal hearing sort of get used to and tune out. And that somebody who's newly fitted with hearing loss or newly fitted with hearing aids, who maybe hasn't heard those sounds in a while, need to give themselves time to adjust to. And so coming in with the right expectations around the time that it will take to get your brain used to listening with these devices, I think is really important to success.
Yeah, so if I can give an example, many of us, have known people who have an apartment or a house that's right by the railroad track. And if you go to their house, it's like all you can hear is the trains and the railroad track or the subway going by all the time. And the people who live there don't hear it anymore, right? Because they've learned to accommodate, they learned to listen to what's important to their brain. And the same thing, if you haven't been hearing well for some time, it's going to take your brain time to figure out which are the important sounds, how to tune out the things you don't want to hear. And that's why a really good return policy, a trial policy, and remember, you might need hearing rehabilitation services. You might want supportive services like captioning to help with your hearing. You want to learn how to look at faces and see expressions and follow the lips.
Oops, we lost you for a second, Charlotte. We'll get back to you. She's talking about assistive technologies and coping strategies. We had a question going back on the insurance coverage and costs, and I think it's an important one. Does Medicare pay for OTC hearing aids? And I think it's important to say that traditional Medicare or original Medicare does not pay for hearing aids and services. It does pay for cochlear implants and implantable devices. It will also pay for a hearing test if you get a referral from your primary care physician, but original Medicare does not pay for hearing aids. Some Medicare Advantage plans do. So those are ones that you purchase separately as a supplement to original Medicare. Also, people are asking, will an audiologist help with an over-the-counter hearing device? And yes, it's true. Some people just aren't willing, or they don't feel confident to take control of their own hearing health and to fiddle with programs, but yet an over-the-counter one might be in their price point. Kelley, can you talk about that?
Yeah, it's a great question. I don't, there's prescription hearing aid and sort of the traditional pathway that we've known through a hearing health professional. And now there's OTC, which can be completely driven by and managed by the consumer and the individual, if that's what you choose. But we are already seeing sort of hybrid models and options in between emerge within the service delivery, system. So there are individuals out there, both individual audiologists and also companies that are offering sort of a la carte services. You can purchase an OTC hearing aid through them or possibly through another platform, and they will help provide additional support for you as it's needed. I think the big question there is understanding whether you're dealing with one of these companies that's offering these services or whether you're talking to an individual audiologist up front, is asking the question, will you help me with a device that you didn't sell me? Do you have the capability to work with me on this device if this is the one that I get? So being sort of informed before you make those decisions will be important. Some audiologists may be bound to work with certain technologies and they cannot work with others. So I think asking upfront and making sure you know your options is going to be an important part of that. And also understanding that I think there are options out there, and we're likely, I would anticipate to see more of these sort of hybrid models popping up.
And it's important to note that when you go to a hearing aid specialist or an audiologist, that oftentimes, the price of the hearing aid is just a third. The rest is those bundled services, the testing, the fitting, the return adjustments, which are sometimes very, very important to people, and they need the good care of a hearing healthcare provider. But this additional pathway to care is just another option that's opened up for somebody who maybe needs some situational hearing. They have a mild to moderate hearing loss and can get by, or it's that first step into, hearing loss often is progressive. It could be that first step going forward. To somebody ask if these over-the-counter devices have Bluetooth or Auracast capability or telecoil capability. And these are things that allow people to connect to hearing assistive technology. Kelley, could you answer that?
Sure. Many of them will. It is not a requirement in the FDA legislation that somebody that markets themselves as an OTC hearing aid have that technology, but they should tell you whether or not that technology is part of the hearing aids. And so that would be something absolutely that you should be able to tell about the device before you purchase it.
And, I just think as time goes on and technology evolves and innovates, hopefully we will see that. Will they have rechargeable batteries? 15 years ago, if you would have told me that this little thing in the palm of my hands would be my TV, my computer, my phone, I would have thought there's no way. So, as technology evolves, hopefully we will see all those things. If somebody walks into, say they've decided they want to try an OTC device and they walk into a pharmacy or maybe a Walmart, a big box store that sells these, what are they likely to find on the shelf? A confusing array of many, many products, or what would people expect?
That's a really interesting question. I've actually had that question myself. I find myself walking into these various stores, and my curiosity is what OTC devices, if any, exist. And I will tell you that so far, it's been a real mixed bag. So there are companies out there, big consumer technology stores, big box stores, that I think have a fairly large sample of these devices available, a large display of them. And I've seen a real mixture at sort of the drugstore and pharmacy level shops around the country, even from one CVS to another. So I think, again, my point earlier is this being, still very new for everybody involved. The rollout, is still happening, and we're still in the midst of it.
Right. And that's why I think there is confusion.
Yeah.
There's so many questions, and it is a very, very new market. It's like day one of the market. And that's why we need more information, people to take the survey. Have you tried one? If you have, what are your experiences? What have you learned? And why haven't you tried one? And we're so happy to see Charlotte Yeh has come back with us. Speaking of technology, here she is. Charlotte, we've had some great conversations while you were gone. So we don't mind if you repeat some things. Somebody asked an interesting question in there and in the chat box, and I'm not sure that we'll be able to answer it. But you mentioned balance and falls and hearing loss. What if somebody does not have a hearing loss, or she doesn't think she has a hearing loss, but she knows she has a balance issue? Would an over-the-counter product, hearing aid, help that?
I think that's a great question, but if your underlying reason for the balance is not related to your hearing, an over-the-counter hearing aid may not help you. But as Kelley had mentioned, I know before I got dropped off, that hearing loss is so gradual that you may actually not know or recognize that you have had hearing loss. So I would say, as part of your workup or evaluation for balance, you should get your hearing checked, because every little thing you can add to improve your balance is just worthwhile.
Yeah, and I'll just underscore that OTC hearing aids are not indicated to treat balance problems. So,
right.
Yep.
Right. And somebody asked about the red flag warnings. They are on the side of the box. It's things like, did you wake up with a sudden hearing loss? Do you have pain? Do you have something oozing from your ear? I mean, those things, you really need to see a physician and see what's going on. You wouldn't run to treat a sudden hearing loss with an over-the-counter product.
That's right. And I would add that one of the red flag conditions in that list is dizziness, spinning dizziness, because that is a reason to see a physician.
And those are potentially treatable conditions that are not related to hearing loss. So this is why it really makes sense. Read that label, so you're going in as an informed consumer.
Exactly. Somebody said that they've tried, here we have somebody who's tried them. This is great. She said, I've tried 2 or 3 different OTC aids, and do they all sound like you're in a tunnel? Is that a normal way to hear when you wear hearing aids?
I love this comment. As a practicing audiologist who would fit people with hearing aids, that sort of feedback of, I sound like I'm in a tunnel, was one of the most common things that you would hear. That's a very typical experience for somebody newly fit with hearing aids. Part of that has to do with the fact that you're now occluding your ear, and so your own voice sounds different to you because you have something that's getting in the way of sound in your ear canal, despite the fact that it's helping you hear better. That sort of effect or phenomenon is something that audiologists or hearing healthcare professionals can sometimes play around with to try to improve in prescription hearing aids. I'm not sure how OTC hearing aids, how effective they will be, depending on the type that you've tried, at sort of noodling with that. If it is a self-fitting device, some of them allow you to control the way it sounds. That's what I mean by self-fitting. And some of them come pre-programmed, sort of preset. You choose one, and that's what you get. If it's a self-fitting device, you can play around a little bit with some of the features of it. If it's not, then you sort of have to decide, I would think, whether that's something that you feel like you could get used to, or whether it's too bothersome and annoying and you want to go a different path.
And it can vary by over-the-counter hearing aids. So there are some that are aware of that and can try and work with you through their customer support to manage that sound, particularly the sound of your own voice. How much your ear is occluded by the particular device may add to that tunnel sound or not. So it is worth trying to find the right one that works for you.
And somebody asks, if over-the-counter is so good, why should anyone bother with prescription hearing aids, especially if they're able to handle the technology? So I think this goes back to the question of who over-the-counter hearing aids are for. Kelley, Charlotte?
Yeah, I just want to remind, and I know Kelley keeps saying this, and I'm going to keep saying this, over-the-counter hearing aids are not for all hearing loss. They are really for the early mild to moderate hearing loss. And sort of the typical, and they're usually designed around when your hearing loss is in that speech comprehension type of frequency. They're really designed to help with speech. So prescription hearing aid is really when your hearing loss has become more severe and there are more components and technology that you might need to adjust. And then I can turn it over to Kelley as the audiologist for that. But I think it's so important that OTCs, over-the-counter hearing aids, are not for everyone. They're really for early mild to moderate hearing loss.
Yeah, I agree, Charlotte. They're not for every hearing loss, and they're not for every person. Sometimes I reflect on, what I think is people pick up on our excitement around OTC because this is such a seismic change in the landscape of adult hearing healthcare. And we are excited about sort of the public health opportunity around this, but it is not a panacea. It does not solve all problems related to hearing healthcare. And in fact, one of the things we know that it does is create many more questions and possible confusion. And so there's a lot around OTC that we still need to figure out. So not for every hearing loss, not for every person. And, I would reflect on a lot of the things that we've said today and a lot of the information that's been shared as to whether or not OTC is a good fit for you.
We have a question.
I was just going to say, but if it prompts you where you've can't hear with loud background noise, or you think people are mumbling all the time, or you keep turning your TV up, over-the-counter hearing aids might be a really good first step for that category if you are in that early mild to moderate stage, because it's a little less costly, not necessarily, but it can be less costly. And you can try it yourself and use it in the situations you need it. So I don't want our conversation to say, oh, it's only prescription or only over the counter. It's really where you are in the journey. And if it prompts you to get treated earlier, all the better. We're hearing anecdotally that people in their 50s and 60s are starting to purchase over the counter, whereas most people wait until their 70s, way past when hearing aids could have been beneficial for many years prior.
And I just want to add one, and then I know you have a question, Barbara. I would only tag on to what Charlotte just said, and this is true for OTC hearing aids or for prescription hearing aids. If you have one bad experience, don't let that deter you from trying again. There's a lot of, this is a complicated thing, both the technology and the people involved. And so be persistent in finding something that works for you.
And we do have resources that on our website that point people to different types of over-the-counter hearing aids, who's providing them. There's some great resources like Hearing Tracker, who does a lot of consumer report type reporting on the over-the-counter hearing aids. But a question we have is, what protections are built in by these FDA rules in not legalizing over-the-counter, but what makes the FDA rules make it an over-the-counter device versus a PSAP or a hearable? What should people look for? And does FDA have a website where people can go to answer these questions?
Yeah, this is a great question because the landscape sort of is confusing. We don't just have prescription hearing aids and OTC hearing aids. We also have this unusual category of what's called PSAPs, which stand for personal sound amplification devices. And the distinction between, you know, a PSAP and a hearing aid, whether it's prescription or OTC, really comes down to its intended user. PSAPs, according to the FDA, are they are amplifiers. They make sound louder, which is what hearing aids do, but they are not intended to be marketed for people with hearing loss. That really is the primary distinction. Does that mean that I've never met people with hearing loss who've benefited from PSAPs? No. I think it's another option that's out there, but they technically cannot be marketed for people with hearing loss. I used to think, well, why would somebody that doesn't have hearing loss want to make sound louder? It's a great question. If you had it also, you know, sometimes PSAPs will market towards hunters or bird watchers or people who are trying to amplify even very soft sounds in their environment. Maybe nosy neighbors listening through the walls. I don't know. But the FDA has a fantastic webpage that sort of not only walks you through these distinctions, but also has a table that outlines the differences between prescription, OTC, and PSAP devices.
You know what? I just noticed we have had such a great time. We are out of time. There are so many interesting questions. And Charlotte and Kelley, you're just the absolute experts here. And I want to thank you. This has been a terrific discussion, and I want to thank all the people who have tuned in today. I heard that we have about 500 people watching, and that just shows the interest. And I want to thank our live captioner, Lisa Johnston, the participant, Charlotte and Kelley, for joining me. And we do have more over-the-counter webinars coming up on hearing aids, over-the-counter hearing aids. And next up in our HLA's HearingU webinars is a panel discussion on accessible technology in the workplace. So watch our website for that information. And also, as a follow-up to this webinar, you will be getting more information and you'll get a chance to answer our survey. So I just want to thank everyone for tuning in today. Thank you to our panelists. And we have lots of great information coming out on our website and our resources. So thank you, everyone.